Good afternoon. My name is Eric Wallace, and I am a registered nurse with experience in emergency and rehabilitation nursing. I stand before you today to advocate for a policy that directly impacts patient outcomes, nurse well-being, and the overall effectiveness of our healthcare system. Safe nurse-to-patient staffing ratios. Nurses across North Carolina face excessive patient loads due to inadequate staffing. Research shows that higher patient loads per nurse are linked to increased medication errors, patient falls, infections, and mortality rates. Overworked nurses experience burnout, job dissatisfaction, and higher turnover rates, worsening the staffing crisis. In emergency departments like mine, delayed care due to staffing shortages can mean the difference between life and death. This is not just a workforce issue, it is a public safety crisis. Recently, during a night shift in the emergency department, we were severely short-staffed. A patient experienced chest pain while waiting longer than necessary for critical care. While we did everything possible, the delay put the patient at unnecessary risk. With proper staffing, this could have been avoided. No patient should suffer due to insufficient staffing policies. States like California have implemented mandatory staffing ratio laws, leading to improved patient outcomes, lower readmission rates, and greater nurse retention. North Carolina must adopt similar policies to ensure high-quality, safe patient care. As nurses, we have a duty to advocate for policies that safeguard both our patients and our profession. Two key ways we can influence staffing ratio policies are legislative advocacy. Nurses must actively support staffing ratio legislation by providing testimony, writing to legislators, and working with organizations like the American Nursing Association and state nursing associations. And two, promoting data-driven decisions. Policymakers must use evidence-based staffing models to determine appropriate nurse-patient ratios. Nurses play a vital role in providing data and demonstrating how safe staffing improves patient outcomes and reduces costs. Nurse staffing ratios are a healthcare system problem that impacts safety and nursing sustainability. By implementing evidence-based staffing policies, we can reduce preventable harm, enhance job satisfaction for nurses, and improve patient care. I urge this legislative body to prioritize safe staffing ratios and support policies that enforce them. Thank you for your time and commitment to healthcare policy reform. I welcome any questions and further discussions of this critical issue.